Good morning to Gisela, to all those who make this broadcast possible, to our sign language interpreter, to the radio stations also transmitting this program, and above all to everyone tuned in to this briefing. Today we are going to give a summary of what's happened over the last week, so that the population, which has been following events as they evolve, and especially given certain changes currently taking place, know how to deal with the pandemic. Let's start with the situation as of yesterday. 54 people were diagnosed with COVID-19 yesterday, 44 Cubans and 10 foreigners. Of the 54 total number of cases, 38 are autochthonous and 16 are imported. Of the 16 imported cases, 8 belong to Ciego de Ávila, 2 to Matanzas, 3 to Santiago de Cuba, and 1 each to Holguín, Havana, and Cienfuegos. We're talking about cases of COVID-19 confirmed in Cuba, but which don't count towards the province's overall case rate, as the virus was contracted abroad. Meanwhile, 38 cases diagnosed yesterday are the result of local transmission. 24 from Pinar del Rio, which has seen a spike in cases in recent weeks. Of these, 10 belong to the municipality of Pinar del Rio, 8 to Sandino, 4 to Guane, and 2 to Consolación del Sur. 3 cases were diagnosed yesterday in Sancti Spiritus, 2 from the municipality of the same name, and 1 from Hatibonico. Havana reported 4 cases yesterday, 3 from Playa and 1 from Arroyo Naranjo, while Santiago de Cuba registered 7, 6 from the municipality of Santiago and 1 from Contramaestra. To summarize, of the 54 cases diagnosed yesterday, 33, or 61%, are confirmed case contacts. 16, or 29.6%, contracted the virus abroad, and the source of infection linked to 5 is still unknown. Of the 54 cases diagnosed yesterday, 26 are female and 28 are male. 47, or 87.3% of the 54 cases diagnosed yesterday were asymptomatic at the time of testing. By age group, 10 positive cases diagnosed yesterday are under the age of 20, for a total of 861 children or pediatric cases to have tested positive for the virus since the start of the pandemic. Of these, 816, or 95.1%, have recovered and been discharged from hospital. I reiterate that no children under the age of 20 have died as a result of COVID-19 in Cuba. Meanwhile, 19 people to have tested positive for the virus yesterday are between 20 and 39 years of age. 16 are between 40 and 59, and 9 are over the age of 60. Now, the results over this past week. 244 people tested positive for COVID-19 over the last 7 days, as compared to 354 diagnosed the week before. This week, Cuba registered a total of 58 imported cases and 64 the week before. This week, 2 people died of COVID-19 in the country, 1 in Pinar del Rio and the other in Sancti Spiritus. We offer our condolences to the family and friends of the deceased. This means that the number of COVID-19 fatalities in Cuba rises to 131, with a mortality rate of 1.7%. This week, 422 people were discharged from hospital. The week before, there were 333 discharges. Meanwhile, the source of infection linked to 18 cases is still being investigated. This week, 77.4% of cases were asymptomatic at the time of testing. 5 patients were reported as serious and 4 as critical. As of yesterday, 1 person was reported as serious and another as critical. Meanwhile, Cuba's confirmed case rate per 100,000 inhabitants over the last 15 days currently stands at 5.88. Pinar del Rio continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days in the country overall, with 69.71. Ciego de Ávila follows with a rate of 21.74, then Sancti Spiritus with 15.67, and Havana with 1.87. Artemisa has a rate of 1.55, Santiago de Cuba 0.77, Camagüey 0.39, Villa Clara 0.26, and the rest of the provinces, such as Matanzas, Mayabeque, Holguín, Cienfuegos, Las Tunas, Granma, Guantánamo, and the Isle of Youth Special Municipality, with 0 cases over the last 15 days or more. To summarize, 7,541 people have been diagnosed with the virus in Cuba since March 11th. 7,347 are Cubans, 194 are foreigners. Meanwhile, 6,876, or 91.1% of all cases, have been autochthonous. 645, or 8.5%, are imported cases. 53.4% of all cases diagnosed on the island since the start of the pandemic are male, while women account for 46.5%. And 62.2% of all confirmed cases on the island were asymptomatic at the time of testing. If you look at the graph, you can see the number of cases per month since the pandemic began. There were 212 in March, 1,324 in April, 547 in May, 265 in June, 286 in July, then a spike in August with 1,432, through to September with 1,605. This number started to decline in October with 1,265 cases and 605 thus far in November. Since the pandemic began on the island, the highest number of fatalities occurred in the month of April, with 57, after which the rate began to decline, with 19 deaths in May, 3 in June, 1 in July, 8 in August, 26 in September, 6 in October, and 3 thus far this month. This week, 60,083 samples were processed, 424 more than the week before. And as we have seen over recent weeks, the highest number of samples are from Havana, represented by the reg segment with 37.5% of the total. Pinar del Rio follows with 24.8%, then Ciego de Ávila with 6.4%, Matanzas with 5.1%, and Sancti Spiritus with 5%. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in 186 countries. Over the past week, 3,960,961 people were diagnosed with the virus, for a total of 52,142,564 confirmed cases worldwide since the start of the pandemic. Meanwhile, the global death toll stands at 1,284,610, with a mortality rate of 2.46%. The United States continues to be the country worst affected by the pandemic, with the highest number of confirmed cases. Then comes India, followed by Brazil. In fourth place is France, then Russia and Spain, following a spike in cases in these countries. The region of the Americas, which accounts for 43.15% of all cases worldwide, has a total of 22,503,850 confirmed cases, after 1,274,135 new cases were registered over the past week. Meanwhile, 17,954 people died of the virus during the last 7 days, for a total of 669,855 COVID-19 fatalities since the start of the pandemic, and a mortality rate of 2.98%. Not much has changed regarding countries. The United States continues to be the nation worst affected by the pandemic at a global and regional level. Next in the Americas comes Brazil, with an important number of cases and deaths. deaths. Then comes Argentina and Colombia. Given the number of confirmed cases reported on the island, Cuba continues to occupy 21st place in the region. This is the information we have on the pandemic in Cuba and the world.